Well, I wanted to continue in August. August is we're focusing on drug-free pain relief and some new technology and some new solutions to that. So I wanted to continue our series on chronic pain today, and we're discussing some really remarkable new solutions that are 100% drug-free, surgery-free, all natural, and most importantly, completely effective. There's some really neat new things out there in regards to chronic pain relief. And so, those people that haven't sort of looked up from their day to see new things that might help them really need to take a look at it, because we've put together a new program. And what it does, it couples the 4 most effective new treatments for chronic pain together as one treatment program. And the success has really been something that's almost unheard of in the healthcare industry. And by coupling these 4 treatment protocols together as one treatment program, that's been a critical piece of the puzzle, because the thing is, if each one of these things helps the person 20%, then we have just reduced their suffering by 80%. Yeah. So you don't necessarily have to find this magic bullet. People think of it sort of that way. What's the one thing that's going to help me? Well, what if we do 4 things and each one of them helps you 20%? Then we've just eliminated 80% of your problem. And so the 4 most effective drug-free technologies that are really available anywhere in the United States, and we do them simultaneously in a very efficient treatment protocol. And that's been one of the big keys to our success in treating chronic pain. It's sort of this broad spectrum of technologies approach, is where we don't expect to find one single magic bullet. But if we put 4 of the most effective things together in one treatment protocol and they each help you 20 or 30%, we've just gotten a long ways towards success with your chronic pain. It's been pretty neat. So first of all, I want folks to know that rule number 1 is that symptoms are not normal. Pain is your body's sign that it sends you telling you something is wrong. So the pain itself is not the problem. The pain is not what's wrong with you. And that's one of the big mistakes people make, is they think, okay, I'm a chronic headache sufferer, so my problem is my chronic headaches, or whatever the chronic pain may be. That is a signal your body sends you telling you damage is being done or that something is wrong. And so it's whatever's causing it that's the real problem. That's what's being missed here, is the underlying cause of this pain. And so it's never normal to have symptoms. Anyone that is having symptoms is a sign that something is wrong. So pain is kind of like your check engine light on your car coming on, telling you there is damage being done or something is wrong under the hood. And so people treat their cars better than they actually treat their bodies all the time. I mean, could you imagine if you were test driving a brand new car, and so you're in the driver's seat and you're driving along, and the salesman's in the passenger seat. That happens sometimes, and the check engine light kept flashing, and he was going, "Oh, that's normal. Don't worry about that. That'll go away in a minute. It doesn't mean there's a problem somewhere." Would you buy that car?
No.
Never.
Never.
And so the salesman says, "I'll tell you what I can do. I got a special deal. I'll put tape over it. You'll never even know that it's there." You would never buy that car, but that's what people do with their bodies all the time. And that's what leads us down the road to develop chronic, serious problems, is because, medication has gotten so effective that we can just cover things up over and over and over and ignore the underlying cause. So don't go down that road. Let's find natural solutions that no one else has looked for. And that's kind of what we do with our chronic pain program, is we find solutions for complicated pain syndromes that no one else has been able to fix, or no one else has found the underlying solution for. And so that brings me to rule number 2. And rule number 2 is something that I call yes, you, because you see, chronic pain patients have a tendency to do this thing where they feel like that their case is the one case that is too complicated and nothing that'll help them. And it's like almost every patient that has chronic pain feels this way, that if they could have been helped, the quote unquote specialist they went to would have told them about it. So rule number 2 is don't rule yourself out of trying something new just because you feel like nothing could be done. Almost every chronic pain patient feels this way. Oh, doc, you can't help me. I have X, Y, and Z complication. Or, doc, I've already had surgery. You can't help me. Or I'm sorry, doc, I suffer with chronic migraines from my sinuses. You can't help me. Or, this runs in my family. Listen, don't prejudge your results and continue with a life of pain because you were told or you feel like that solutions don't exist. No, your complication is probably something that we've dealt with. So rule number 2 is don't prejudge yourself out of a good life because you have this preconceived idea of your condition being uncorrectable.
Don't prejudge yourself out of a good life.
Yep.
That ought to be on a bumper sticker.
It should.
Don't prejudge yourself out of a good life. Wow.
And I see that all the time. Almost every chronic pain patient feels like their case is the one that we can't do anything about for some reason. So don't prejudge yourself out of a long, healthy, good life. And so that's why we say rule number 2 is, yes, you. We're talking to you too. Yes, you have the possibility of finding a solution for that. So that's kind of the 2 precursors to our chronic pain program. And before we go to break, though, and by the way, after the break, we're going to get into some new technologies and we're going to discuss some breakthroughs in something called laser therapy for pain relief. It's real exciting. But I wanted to first invite everybody listening that has pain and would like to get rid of it to my in-office open house and workshop that we're going to have on 4 drug-free breakthroughs in pain relief. And it's going to be an open house setting, which is a little different than what we usually do. So we can actually bring you from room to room in my office and show you and demonstrate these technologies to you so you can see them for yourself. And so we're going to have on August the 28th at 6:30, we're going to have everybody come in, sit down in the reception room in my office. We're going to talk to you a little bit briefly about how each technology works, and then we're going to walk you from room to room and display each one and show you how it works. It's going to be pretty fun.
That's a great idea.
And so after the break, we're going to get into these new technologies, so don't miss it. And by the way, if you want to register, you can pre-register now. You can call 837-7174 in Lafayette or 367-2567 in New Iberia, and this open house is filling up quickly. So call right away. It's 837-7174.